talking about COVID-19, our safety protocols and leave and things that go along with that. Biggest thing to summarize our safety protocols, the main changes that we have for this year that we really have to do is, number one, we're wearing masks whenever we can't guarantee 6 foot of social distancing. So whenever we're in the building, anywhere else, kids, everybody has a mask on. Once we get kids seated in a room and we have everybody socially distanced and we can guarantee 6 foot or more distance between everybody, we will allow our kids to take off their mask at that time. If a teacher's seated at their desk away from everybody, that would be fine. If they're up instructing, we expect that mask or that shield to be on. You know, when we're talking about a face covering, it can be it can be a mask, it can be one of the neck gaiters, it could be a shield. Another thing we're expecting every kid to do is when they come in the room, anytime they enter or leave a room, they're doing hand sanitizer. We want clean hands coming in and we want clean hands going out. That way when they're in the hall and they put their hand on, around their buddy's, shoulder or touch somebody's face accidentally or whatever, it's a clean hand, so we'll make sure we do that. So each teacher, you be at the door and you're gonna be you're gonna be doling out hand sanitizer as they go in. And the last big change it really is when the kids leave, we're wiping down desks, we're wiping down the touch point areas, doorknobs, things of that nature. If every kid comes up and staples something, we're wiping down the stapler. But trying to do that in between every period. Our custodial staff's gonna be coming in doing extra clean. They're gonna be fogging every room every night and doing those types of things. If there's anything that needs additional cleaning, you just gotta let the principal know and they'll make sure the lead custodian's aware so they can come in and make that happen. Of course, everybody self-screens before they come to school. We're asking our older kids to do that. With our younger kids, we're checking temperatures because they don't even know a lot of times whether they don't even know sometimes they have a fever, they feel bad. They get kind of whiny. So we're gonna be checking temperatures with our kindergarten and our elementary, middle school up. We're expecting parents and them to help us self-screen. If anybody's got any symptoms, we're gonna be asking them to stay home. Also, what we're looking for is anytime we get a COVID-19 positive, that means somebody has been tested and it's a COVID-19 positive, that's gonna initiate somebody to stay home for 10 days from the date that their symptoms started. So in order to come back, they've got to be basically symptom-free, of course, no fever for 48 hours and 10 days from when they started. So, and that's only on a positive. And a positive means not somebody thinks they have it, that means somebody has been tested and confirmed. If somebody thinks they might have symptoms and needs to get tested, our nurses are able to do that. Anytime somebody starts getting multiple symptoms of something, we're gonna automatically assume that's COVID-19. We're gonna be sending those people home, and we're gonna need a COVID negative test in order to guarantee that. Otherwise, they're gonna have to wait the 10 days. The next big thing that really affects us, and this is what we're seeing probably affect us more than anything, not the COVID-19 positive cases. We're not seeing a ton of those. I think our mitigation factors are really helping us in keeping those at bay, but we can't control what people do outside, so you're gonna have those cases. Dad gets it home, next thing you know, son's got it and he comes to school. Well, we can keep it from spreading in here as long as everybody follows the safety protocols we talked about. But in the event somebody gets an exposure, and an exposure is defined is you are closer than, you're 6 feet or closer without a face covering for 10 to 15 minutes of somebody that is a COVID-19 positive person. That's an exposure, that's the definition. An exposure should never happen at school. If we have masks on the list, we're guaranteeing social distancing, there's no way an exposure should happen here. And so we gotta pay close attention to that. We should never have an exposure. Anytime we do have an exposure, it's usually gonna be within the household. What we've seen this year, when we do get a kid who tests positive, the exposure is siblings or the neighbor next door that came over that's also a student. And if it's an exposure, they're out longer than if they had an exposure is out 14 days. And the reason being, because that virus can lay dormant within you for up to 14 days. Now, if somebody tests positive for COVID, let's say Eric tests positive today. When was I exposed if I was around him yesterday? Well, how they decide from the date your symptoms start, 2 days prior to that, until symptoms until you're fever-free, you're considered infectious. So if Eric tested positive today, it's Wednesday, he was infectious on Monday, on Tuesday, and today, and of course, until his fever subsides. So if I was exposed to Eric without a mask closer than 6 feet for 10 to 15 minutes, then I would have an exposure and I'd have to go home for 14 days. If I was around Eric, but I had my mask on, he's wearing his mask, then I would not have an exposure. Now, let's say that I had an exposure to Eric, but I don't, Eric has it, I do not, and my wife is around me. My wife is not exposed yet because I don't have it. I'm the only one that was around Eric. Now, if I came down with it, then yes, she would be exposed at that point, unless she social distanced from me from the time that I was exposed to Eric. But the exposure lasts 14 days. And, the big one is the assumed COVID. In this time, whenever somebody is assumed to be COVID, starts showing symptoms, we assume it to be COVID until we're proven differently. And as I said, that takes a negative test, and our nurses can actually give that test. Probably the biggest spreaders that they see in the COVID-19 is with our asymptomatic people, and that's people that have COVID but don't even know it. They don't even show any symptoms. In that case, usually the only way you find out is somebody in the household comes down with it, shows symptoms, they get tested and they test somebody else in the household, such as them. Asymptomatic people are considered infectious 2 days from the time they get their test, their test done. And then they've got to wait their 10 days because they're not showing any symptoms. Now, how do we protect ourselves against asymptomatic? Well, we follow the safety protocols. We wear a mask unless we're socially distanced. We use hand sanitizer. We wipe everything down. That prevents that spread from asymptomatic people. If everybody follows these, it's shown already this year to mitigate the spread of COVID-19. And I know people have a lot of questions about, okay, what happens if I get it? What am I paid? Can I work from home? Things of that nature. So I'm going to turn it over to Eric now and let him talk about that.
Exit stage left.
And I'll put my mask on.
My mask is off. I'm socially distanced. And hello. Just to reinforce a couple things that Mr. Cluxton said. Purpose of this whole training is to keep safe, keep schools in session, keep our paychecks, and keep our focus, because we want all 4 of those things going on as we have school starting. Once again, practice our social distancing and our mask or face coverings on campuses. And just a reminder that all jobs are voluntary. We've all chosen to be here. All jobs are vital. And at some point, some jobs can be done remotely and other jobs cannot be done remotely. And that's just a fact of life, and that's something we take on a day-to-day or a case-by-case basis, but we do go through our checklist at the HR department on whether a job can be done remotely or not, if COVID is a reason or not. I know I'm just speaking the choir because you're here at work. You've chosen to come to work, and we appreciate that because you're the best person for our kids, and we appreciate you being here. So to be specific on some of the leave situations, and if you do come down with COVID or have to be quarantined, there are very specific criteria from the Department of Labor that we have to follow. First of all, if you get tested or sick or in the need of being tested, please make sure you talk to your supervisor, whether that's your building principal or your department head. They will then let Dr. Baxter know, and they will let the HR department know that something is going on, and we can make sure that we can continue your pay in the manner that needs to be, and you get the leave that you're required to have. So, a couple things. In order to be paid when you're on quarantine or you're sick for COVID-related diseases, you have 1 of 3 things that you can get up to your daily rate for 10 working days, and that would be you are subject to federal, state, or local quarantine or isolation. So that when we talk about being out for 10 days or 14 days, that's a local quarantine. Or have been advised by a healthcare provider to self-quarantine due to COVID-19. You go to the doctor, you get tested, or the nurse tests you and they say you need to quarantine because it's related to COVID and it's been you've been referred to stay home or ordered to stay home, then that would qualify for COVID relief pay. Or you're experiencing COVID-19 symptoms and you're waiting on a medical diagnosis. So let's say Monday morning you wake up and you're just wiped out. You think you possibly have COVID. You don't want to expose anybody else. But you can't get into a doctor for a certain period of time. So you are waiting on your diagnosis. As long as you let your supervisor know, we can start the paperwork to make sure that that does meet the criteria for COVID relief pay. You also could be possibly eligible for two other reasons for 2/3 of your daily pay, which would be you're caring for an individual subject to an order described in number 1 or number 2, which is self-quarantine or been advised to stay home. So if you're caring for someone, you can get paid up to 2/3 of your daily rate for up to 10 days. And then the last one would be caring for a child whose school or place of daycare or care, like you can't find a daycare provider, you can actually qualify for up to 12 weeks of expanded care at 2/3 your qualifying rate, but it has to be documented. Also, once again, none of these are assumed. You have to communicate with your your supervisor and or your principal immediately. They will work through this process with you, okay? Don't just stay home and expect your check is going to come regular. If we don't know what's going on, you won't qualify, I promise. All right, now this is law through December 31st of 2020. There's no guarantee it's going to extend past that. I can't predict what the federal government's going to do any more than I can predict what the state government's going to do. But this is in effect through December 31st. So a couple things is make sure you're taking care of yourself. Make sure you're keeping your supervisor informed if something is not going right. We want you to be healthy. We want you to drag yourself to work, which I know you want to do because you're sick, but you want to do your job because you feel very high responsibility. We understand that dilemma. That's why the 2 weeks of paid leave is there. We don't want you continuing to reinfect people. So work with your supervisor, and then we'll work through the other part. Okay. So, once again, the enemy of us right now, the hardest people we're going to have to tackle is the I don't want to wear a face mask group. You might want to stay away from them as much as possible because you don't want to be sick. Because 10 days will go very fast, and if you're positive, it may be very painful 10 days. So please make sure you're taking care of yourself. Everybody follow the protocols. We should not have an issue, like Mr. Cluxton said. Report your supervisor immediately. Call us at HR if you have any questions. Myself or Melanie Ferguson will be more than happy to visit with you about it. And I appreciate your commitment to student success. Take care of yourself. We're all in this together. Thanks, everybody. Go Pirates.